So when looking at the delt, they all insert into the deltoid tuberosity, so clues in the name. So there's this bit just below the head of the humerus. And you can see this on people. So if you had somebody and you can follow where the delt goes down, you can see where that insertion is. That's going to be slightly different on everybody, so you want to make sure whatever exercise you're doing for your delts, that it's lining up with that insertion, especially if you want to go for the lateral head. So breaking this down, they'll all go from here, and there are various attachments in towards the midline of the body. So we've got these fibers that run across the front, which will attach onto the clavicle here. And we've got these fibers that come over the top, attached onto the acromion process and onto the clavicle. And also they will go onto the spine of the scapula, so the top of the scapula. And we want to make sure here that we line up whatever part of the delt we want to work with the fibers we're trying to look at. So if we're looking at the lateral head, which comes out here, we want to make sure that if I'm pushing down on this arm here, that these fibers that are on top are the ones that are going to be working. So they are resisting the arm being pulled downwards. If I'm going to be looking at front delt, I'm probably looking at turning the arm in, and now if I push downwards on this front delt is going to be the thing that's going to be working most. And then for rear delts, you want to make sure this is the thing resisting the load. So if I had an arm out here and a cable pulling in this direction, this thing resisting the cable this way is going to be that rear delt. So when we're looking at this, we want to make sure whatever's on top works the most. So for lateral raises here, what you often see when clients start to fatigue is them going to turn out this way. This is them going for the more advantageous and stronger front delt that are used with all their pressing movements, instead of using what they're trying to challenge, the lateral delt. So just make sure this will always stay on top. One further thing to note when it comes to training delts is that our scapula on the back of our rib cage doesn't sit in a shoulders back and down position. The rib cage curves round and it'll sit on that angle. So if I pull my shoulder blades back and down and come right to the side, I'm going to run out of room and hit this glenohumeral joint. Whereas if I allow the shoulder blades to come slightly forward, aim at a 10 and a 2, we have a much bigger range of motion to miss this part of the joint and to get the delts much, much shorter, creating a much bigger challenge. So when we're looking at trying to train the lateral head of the delts, the cable lateral raise is a really, really good variation. The reason why is because when you're doing dumbbell lateral raises, when you're weaker up here, it's going to be really, really heavy. And this bottom third is kind of pointless. So what the cables will do, as you can see here as Kev gets set up, at this position, the cable's still at the bottom for me, Kev. It's still pulling him towards this cable stack. This moment arm, so this line of force, is further away from the shoulder. As he starts to come up, you can see this cable now will start to get closer and closer to his shoulder, meaning it's lighter as he gets into this weaker position. This allows for more consistent tension throughout the whole range of motion, allows him to get much more from this exercise. Key things to think about here is think about pushing the handles away rather than pulling up, so he's pushing into my hand to make sure this moves first, and this part of the delt on the side should always stay on top. One of the biggest sticking points I see with the cable lateral raise is that for some people, especially female clients, these jumps on the cable stack, it can be a big jump for people, going from something that's very, very easy to something that's almost impossible. An easy way to progress this and manage this is changing the moment arms by adding in cuffs that will shorten the lever. So normally when we're holding it with our hands, if you come out, this cable now will be in line with here. This is going to be a bigger moment arm and a greater challenge to that delt. Bringing the cuff in above the elbow does two things. One, it shortens this moment arm, making it a bit easier in this position where they're going to be weaker. And two, if they're new to this, it takes away the thought process of having to control the wrist. All you have to think about is just one joint and the joint you need to work. From there, before you actually increase in weight, you can make a progression to the hand to make it a little bit heavier. And then after that, you can maybe go up a plate, start at the elbow, and then repeat that cycle to have little micro progressions in between plate to plate.